I'm Priyadarshini. My topic is about general mechanism of antiviral vaccines. Coming to introduction, the first modest search of antiviral drugs occurred in early 1950s. Chemists looked at derivatives of sulfonamide antibiotics. Edoxyuridine is the first useful antiviral. Vaccines. A vaccine is a biological preparation that improves immunity to a particular disease. Vaccine is substance introduced into the body to prevent the disease produced by a certain pathogen. It consists of dead pathogens are live but attenuated organisms. Vaccine induce immunity against the pathogen. Antiviral drugs. Antiviral drugs, any agent that is used in the treatment of an infectious disease caused by a virus. Viruses are responsible for illness such as HIV, AIDS, influenza, herpes, simplex, like that. And type 2, herpes zoster, viral hepatitis. Antiviral drugs are a class of medication used specifically for treating viral infections. Specific antivirals are used for specific viruses. Viruses cause more disease than any other group of parasites. They can cause blindness, deafness, paralysis, mental retardation, various birth defects, and in at least a few plant and animals. Uh, once that should be stated as measles. A virus can contain either ribonucleic acid or deoxyribonucleic acid, but it never contains both of them together. Viruses have no cell wall and made up of nucleic acid components. Virus containing envelope antigenic in nature. Viruses are obligate intracellular parasites. They do not have a metabolic machinery of their own, uses host enzymes. Certain viruses multiply in the cytoplasm, but others do not in the nucleus. Many antiviral drugs are purine and pyrimidine analogs. Many antiviral drugs are prodrugs. They must be phosphorylated by viral or cellular enzymes in order to become active. Antiviral agents inhibit active replication so that viral growth resumes after drug removal. Antivirals, how they act. They can able to enter the cells infected with virus, interfere with viral nucleic acid synthesis or regulation. Some drugs interfere with ability of virus to bind to cells. Some drugs stimulate the body's human system. Best responses to antiviral drugs are in patients with competent human system. Mechanism of antivirals. Most of antiviral vaccines work by inducing antibodies specific for the surface glycoproteins of enveloped viruses or the capsid proteins of non-enveloped viruses. Antibody is the primary element of adaptive immunity that is designed to pre-exist at protective levels and be present re-exposure to the viral pathogen. Conclusion. Antiviral drugs, unlike the most antibiotics, so do not destroy their target pathogens, rather inhibit their development, as the viruses use the host cells to replicate, hence makes it difficult to design a safe and effective antiviral drug. Thank you.